This is a lecture on Pharmacology, Exam 4, covering beta-lactams. I'm kind of regretting using this lighter color. I'll get in here, but I'll just try to read up what it is. So starting out here, beta-lactams, there are 4 general categories of beta-lactams. There are the natural penicillins. There is the penicillin-resistant anti-staphylococcal penicillins. There's the extended spectrum amino penicillins, and then there's the extended spectrum anti-pseudomonal penicillins. Essentially what this is penicillin has anti-bacterial properties, but as we used it a lot, mutated strains of bacteria started becoming resistant to penicillin, and so what we have done is we have added things onto it that overcome the bacteria resistant. So the ones at the top, these are ones that essentially, they have the least spectrum, they have the most narrow spectrum, and the one down here at the bottom has the broadest spectrum. So starting out here at the top, I'm just going to list these in this one. The next lecture I'll try to figure out ways to memorize them. I'll point out a couple little things I've noticed these. So first of all, we have Penicillin Vk, and this is given via the oral route. So maybe a way you can think of that is that Vk kind of looks like Viking, maybe. You think, well, Vikings eat a lot, okay? So Vikings eat a lot, so they're oral, okay? And going over here, the half-life for most of these is 30 to 60 minutes. At least that's what the one that they listed was. And the oral absorption for Viking penicillin, Penicillin Vk, is 70%, which means if you put it in your mouth, about 70% of the drug will actually go into your have bioavailability. And then I'll cover these at the end. This is what the therapy and the spectrum. So Viking Vk is oral. There's also G, okay? So just penicillin G is given intravenously, and this is the only one that's given IV. And it may be, I'm not sure exactly a good way you can remember that, but if you can just remember G being IV, maybe GIV looks like give, so you give it, or I don't know, give it IV. So anytime that something is given intravenously, it appears to me, as far as a pattern that I found, is IV seems to have renal excretion, which makes sense because you're putting it directly into the blood, so it's probably going to be something that's going to be able to be, travel through the blood, and it's going to be excreted through your kidney, renal excretion. So this is actually the IV, the penicillin G, is 70% excreted renally and 30% hepatic, or in the liver. And this is the one that has 30 to 60 minute half-life. Next we have penicillin G Ben Xanthine. Now when I think of the word bends, I think of how an arm bends. In order to bend an arm, we need muscles. So this one is given intramuscularly. Bends, penicillin G Ben Xanthine, intramuscularly, bends, okay? Next we have penicillin G Procaine. And people who are pros have to have a lot of muscle, okay? So you think of a pro and having, lots of muscle, they can, move around and be a pro, whatever. So that's also given intramuscularly. Okay, now as far as what these things do, they do the least amount of stuff, I believe, is my understanding. So these natural penicillins, it seems like all these get streptococcus. Streptococcus is like strep, kind of sounds like strippers, or like a stripper because it's everywhere. It's on all these. Okay, yeah, that's a terrible analogy, I apologize. But streptococcus, that one's on all these. So also on here is Streptococcus pneumoniae, kind of a similar thing. It seems like it's on pretty much all of these. And then you have Enterococcus, and you have Clostridium perfringens. Okay, so these natural penicillins, they are beta-lactam natural penicillins. These are the ones that they target, and that makes the acronym CEP S, S, and if you think, the penicillin typically comes from, I guess it grew on molds, so you think of a cesspit coming from cess, this is what it gets, is Clostridium perfringens, Enterococcus, Streptococcus pneumoniae, and Streptococcus sp. Okay, so what do you treat with this? Okay, well, what you're going to treat is going to be syphilis, which is Treponema pallidum, as well as strep pharyngitis, which is caused by Streptococcus pyogenes, as well as enterococcal and streptococcal endocarditis. Okay, so syphilis, pharyngitis, and endocarditis. Those are all treated with natural penicillins from this list. Okay, next one. We have methicillinase resistant anti-staphylococcal. So this one has, apparently the bacteria started growing this little thing called penicillinase, which basically went in and busted up the beta-lactam ring. And so what do we have to do? Well, we had to add something onto the structure of the drugs that we were giving to make them penicillinase resistant. Okay, so these are drugs that have that thing added onto them. And these are a little hard to remember because all of these first ones all start with penicillin. Okay, penicillin, 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 penicillin. We had the different things we added on there for what it was used for. But these ones all have different kind of names. Okay, so that's kind of hard. It makes it a little hard to remember. But I will I'll try to come up with some way that we can remember these. Okay, so first of all, Dicloxacillin. I don't know if you can see what this says. I'm just going to try to write it down. I don't know if I'll have time for this. So Dicloxacillin. Okay, and Dicloxacillin is given orally, and so is Cloxacillin. This is Cloxacillin. Okay, so you can think of a gross way to remember Dicloxacillin being oral because it starts with dic. Anyway, terrible ways to memorize things, but maybe it'll help you to remember it. Also, this Cloxacillin, maybe you can combine the two, remembering these are both given orally. Maybe you could, draw a clock here and put something. We'll worry more about how to memorize these later. For now, I'm just going to introduce them. I'm just going to keep going with introducing them. So anyway, so Dicloxacillin and Cloxacillin are both given orally. And looks like Dicloxacillin has about 35 to 76% oral absorption, so not incredible bioavailability compared to the other one. What is it used for? Well, maybe I'll introduce the rest and then I'll talk about what they're used for. So next we have Nav Nafcillin. So Nafcillin is given intravenously, and it's mostly hepatic. And it has a half-life of 30 to 60 minutes. Next we have Oxacillin. Oxacillin is also given IV. So I don't know, maybe the way you could think of this is, well, I'll go over this more later, I guess. But there's ways you can remember this. Okay, so what is this one used for? These penicillinase-resistant anti-staphylococcal are used for mild to moderate staphylococcal infections. Apparently, when it is mild to moderate, they give it orally. Okay, so it looks like probably Dicloxacillin and Cloxacillin. But if it's a moderate to severe staphylococcal infections, they give it parenterally, which means like through the skin. Okay, so mild, not a big deal. You take it by the pill. But if it's a serious deal, we're going to give you an injection. Okay, so what do they treat here? We have Streptococcus, Strep pneumoniae, Staphylococcus aureus, but non-MRSA, not methicillin-resistant Staphylococcus aureus. Okay, next we have the extended spectrum. Extended spectrum aminopenicillins. There's two of them. They both start with A. The only ones so far that start with A. Amoxicillin, and it's nice because amino starts with A, and both of these ones start with A. So these are the aminopenicillins. So amoxicillin and ampicillin both start with A, and aminopenicillin starts with A. None of the other ones start with A. They're both given orally, okay? So you think, you're going to eat your protein, your aminos, or whatever, you're going to take it in orally. Maybe that's a way to think of it. But the ampicillin, you can also amp it up by giving it IV, okay? So you can amp up the use of ampicillin by giving it intravenously. And This apparently is excreted renally. Okay. Oh, I forgot to mention. Sorry, the penicillinase resistant staphylococcal. Apparently, it's mostly excreted hepatically. Okay, so hepatic excretion for the most part. At least Nav Nafcillin is excreted hepatically. Okay, so which might overcome what I said earlier. Darn it, forget the whole IV thing with the excretion. Okay, so it has a half-life of 1 to 1.5 hours. It has 100% oral absorption, and it is used for enterococcus infections of the urinary tract, central nervous system, soft tissue, or pulmonary system. And this handles a lot more stuff. It handles streptococcus pneumoniae, enterococcus, Clostridium perfringens, Prevotella melaningiogenica, I don't know how to say that, and as well as Pseudomonas. So this, a lot more stuff, okay? So as we're getting further down to the bottom, the amino penicillins handle a lot of things. And lastly, going down to the extended spectrum anti-pseudomonal, we have TP. So these are the anti-pseudomonal and TP. Ticarcillin and piperacillin. Okay, think of a tiger smoking a pipe or something. Maybe that'll help you remember it. So these are both given intravenously, kind of serious big deals. I mean, by the time you get down here, it's such a big deal. They give it IV. Maybe you can think of it that way. Renal excretion, given IV. It goes out through the kidneys, and it's 1 to 1.5 hours for its half-life, and it is used for Pseudomonas aeruginosa infections of the urinary tract, central nervous system, soft tissue, and pulmonary, and it kills everything except for MRSA. Okay, so everything, anything that you could have, it gets handled by extended spectrum anti-pseudomonal.